Hello, I'm Dr. Brian Gibson, and I'm here today to talk to you about cramps, especially leg cramps. Leg cramps are a common problem. They're actually really common, especially at night, and they can be an indication of multiple different things. But before we get there, let's talk a little about um, how often people get leg cramps. Leg cramps are 75% at night, 25% during the day. People over 60, 33% will have leg cramps at night at least once every 2 months. Nearly every adult age 50 and older will have at least one cramp at some point. 7% of children will as well. Approximately 40% of pregnant women will get leg cramps at night. Basically, they're quite a common problem. Um, Leg cramps are usually severe pain, cramping. They can cause muscles to tighten and so forth. They usually don't cause anything more serious. I mean, they're not going to cause you to break your leg or anything like that. I've had people ask me that. That's not going to actually happen. Causes of leg cramps that are not related to bigger problems could just be an involuntary nerve discharge, stress, muscles that are tired, so overuse or after high intensity exercise, um, interference of blood flow because of a position or something when you're laying down or sitting down, standing or working on concrete floors for long periods of time, sitting improperly. All these can actually cause it. But the truth is there's also many other causes that can actually cause leg cramps, including certain types of medications like gabapentin, naproxen, pregabalin, statins, some antibiotics, certain other medications can actually cause this. You could also alcohol. An addiction to alcohol can cause leg cramps. Pregnancy, like we've already said, can actually cause leg cramps. The most common is dehydration because of lack of sufficient water in the body. And so most of the time I say, let's start with dehydration, see if we can get that better. You can actually look at magnesium and potassium, although there's starting to be some thoughts that magnesium may not cause leg cramps. There are some more serious problems that could be indicated initially from leg cramps, such as motor neuropathy or muscle nerve problems, ALS or Lou Gehrig's disease, cardiovascular disease, where you got issues with the circulation, diabetes, primarily because of blood sugar issues and so forth, kidney problems, osteoarthritis, Parkinson's disease, and peripheral arterial disease, or peripheral vascular disease. They even say, I guess, liver cirrhosis can cause this. So all these can be causes of leg cramps. They can be a pretty big deal, but they're really commonly treated by treating the issues. So if you're getting leg cramps all the time, I'd look at potassium levels, I'd look at water intake, and I'd look at blood flow are the most common things. And truthfully, sometimes you can actually treat this really easily just by doing a similar treatment to what we do for Raynaud syndrome, which is taking niacin during the day to reduce that. So if you're getting leg cramps all the time, you want to do something to reduce it, niacin can also help with that. This is Dr. Brian Gibson, and this is your podiatry tips day 391, I believe. Yep, 391. Cramps, and this can be valuable, this can be helpful. If you have any questions, reach out to us at utahfootdoc.com. We'd love to help you and help you prevent or eliminate leg cramps if it becomes more